So my name is Sheryl Serano Griffith. I am a licensed clinical social worker who has been practicing for about 20 years. And I serve at Prospect Hill as the lead clinician. So in that role, I actually help clients to become exceptional versions of themselves. And we work on ways that we can do that, doing all versions of what life brings at us. So the challenging as well as the giving. And we create a roadmap for each person based on those scenarios. So I love cognitive behavioral therapy. That's the place that I soar. I do a little bit of DBT as well, right? Reality strengths focus therapy, because I feel that that helps clients to have a real life view of who they are, right? And that we can take the skill sets that they walk in with and apply some clinical perspectives to that in order to build what they can continue to be successful with when they leave the therapy room, when they leave treatment and they go back into their lives, right? So it helps a lot to be able to integrate these perspectives into normal day-to-day living. For the clientele that walk through Prospect Hill, what they gift themselves with is a wholesome approach to treatment, a wholesome approach to living. Because when you take yourself, when you have the opportunity to pay attention to the medical side of you, when you have the opportunity to look at nutrition, to look at wellness, to look at therapy, right? Those four prongs and that approach to who you are as a whole, it really helps with making your success real. It's a realistic approach to success. I love that here at Prospect Hill. I think it's something that we do really, really well because clients walk in. A lot of the times they have a lot of challenges that bring them here. And when they leave when they leave Prospect Hill, when they leave from care here, they are able to integrate the skills that they've learned here into their lives. I feel like a lot better than they've ever had before with any previous type of treatment. Okay, so when you look at clients who walk in with the challenges of managing anxiety, depression, trauma, these are things that visit and that exist within a person for a lifetime. So here at Prospect Hill, we help clients to be able to tap into the things that exist around them in nature. Prospect Hill is a peaceful place. Prospect Hill is a healing place just in its environment. So helping a client to tap into the things that are around them that nurture them, teaching them how to use the clinical skills that they gain within therapy and wellness, because therapy and wellness are kind of integrated. And so the skills that they learn within therapy and wellness, teaching them how to apply that into their specific individualized situation, so the parts that are specific to them, and that they build those skill sets, they practice those skill sets, and they can walk out with that. Teaching clients how to eat for wellness, right? We eat to live, and we don't live to eat, right? And so what the wellness component of what that meal can do for you. How do you connect with the fruit bowl that you eat for breakfast? How do you, take the time to sit and enjoy a meal per se? So the therapeutic components of that, right? The importance of movement, right? How movement is tied into us, making sure that you're okay. The balances of your emotional system that is tied into movement and exercise, and going for a swim or sitting at the beach or taking a walk, right? How movement is integrated into the entire system. So when you think about the higher level connections of what we do at Prospect Hill, when we're looking at the four prongs, it's that interconnectedness of the approaches that it ends up being a whole therapeutic journey for every client that walks in here.